So we're all in the addiction treatment system. When y'all hear the term prevention, what comes to mind?
I can talk a little bit about that. At the clinic I work at, we have someone that's trained in SBIRT, which is screening, brief intervention, referral to treatment. So we screen everyone. She walks around all day and just randomly, we don't identify people. So I think it's just asking everyone what their use history is.
And with that, there's a component of education.
Yes,
So
I'm
that
sorry,
if
yes, there is.
If they're screening positive, then
Right.
you would intervene in some way. But if they're negative, then there's room to let them know
Right.
sort of what safe drinking
Right,
is.
and it's not people that have substance use disorders. That's not the point of it. It's people that might be at risk.
Before they
Identifying
develop
those,
that
right.
substance use disorder.
And as Shanna said, that education part of it or the referral part of it that we need to do.
I was just thinking the at-risk, knowing who's at higher risk of developing a substance use disorder and being able to address that with them, certainly through screening, but also if there's sort of some flag for them to know, to be talking with them if there's a strong family history of alcohol use disorder, for instance, to let the person know that they're at higher risk, even if their drinking is at lower levels right now, or to think of certain populations that are at higher risk. So physicians, medical health care professionals have higher rates of substance use disorder, or higher rates of suicide than the general population. So speaking to people just as groups that are high, that you've identified and letting them know their risk.
I think education is prevention, and treatment is prevention, right?
Yeah.
Again, I really think that changing the culture around the way that we talk about substance use, so that if people are using substances at lower levels but are concerned about their own risk, feeling comfortable asking how to prevent things from getting a little out of hand, and I think that comes with culture change.
I can't answer this question. This is a question. What is the role of, since these disorders often manifest themselves in adolescence, we don't have a pediatrician here. What is the roles of pediatricians in making their adolescents feel comfortable to talk with them about their incipient drug use?
Yeah, I mean, I think part of it is, again, universal screening. So every child and adolescent that comes in for a well child visit, making it routine. Making it routine to talk to that individual without a parental figure in the room, and really sort of leveling the playing field and letting them know about what can remain confidential and what can't. That can be really important. I think, again, we've talked a little bit about how hard it is just to get people into treatment doors, and so I think there's a huge opportunity for community prevention as well, and so I think there have been educational interventions to arm coaches and guidance counselor and spiritual health providers and spiritual providers, et cetera, with screening, brief intervention, referral to treatment type techniques as well. So I think really thinking about the broader public health outside of the healthcare system is an important component of prevention.
And there's the prevention of the substance use disorder, but there's also the prevention of all the associated complications or risks that come along with having a substance use disorder. So infectious disease, or sort of drinking and driving, or whatever other negative consequences.
Overdose. Right.
Overdose, right.
So I think that's kind of, in framing this question, it was, we do addiction or substance use treatment, right? But as you said, treatment is prevention, and preventing things is kind of, in a way, it's providing a treatment, whether it's an educational intervention or providing a Narcan kit or a naloxone kit to prevent an overdose. Much of what we do is actually prevention. And getting comfortable with screening of adolescents. I also had a colleague who recently said, when a patient comes in with new onset depression, I absolutely check to see if their thyroid is appropriate. I get a serum level of their thyroid. why aren't we also just checking a urine drug screen and making sure, because we know that depression is highly co-occurs with substance use disorders, but that's not something that we do. We don't necessarily monitor routinely, but we probably should. Perhaps we're not identifying things we should be. So this idea of kind of screening and just making it more universal is in and of itself prevention and treatment.
Although I wouldn't necessarily condone urine drug screening being the way at that, right? I mean, I think the, questioning should be first line, right? And we want to avoid sort of, unless the patient knows you're screening them for that, I worry a little bit about, again, this idea that we're looking for something or we're on some kind of a witch hunt, and just being careful around that.
Right, so if you're going to screen for a thyroid, you would let somebody know
Right.
that you're going to be screening something and
Sure.
get their consent for that. And I think it also does get at being able to interpret these things, right? As Robert has already mentioned, just because there is a urine that's positive for cocaine does not mean somebody has a cocaine use
Right,
disorder.
exactly.
And so what is that context? And
Right.
so it shouldn't be used in a vacuum.
But I would pause with pediatrics. If a pediatric patient is depressed and you start doing urine drug screens, that could open up a Pandora's box of conversations between you and the parents and the patient. So we have to use caution with that kind of screening.
Absolutely. So consent and patient autonomy
Right.
gets at a lot of this, and the ethics.